glaucoma is one of the 2 leading causes of vision loss in this country.
And since it is National Eye Exam Month, it's a good time to find out if a glaucoma screening is something you may need. News
13's Victoria Dunkle is live at Asheville Eye Associates off Sweeten Creek Road. Victoria, how can people protect their vision?
Well, that's a good question because glaucoma, as you mentioned, is a vision stealer. And we're here at Asheville Eye Associates talking to Dr. William Haynes about his specialty, glaucoma. You hear the word, it's kind of got a scary connotation with it because people think blindness. What is glaucoma?
Glaucoma is a disease of the optic nerve, the nerve that connects the eye to the brain. In glaucoma, the nerve deteriorates over time, typically associated with an elevated eye pressure. That leads to loss of peripheral vision in the beginning, and over time that can sneak in toward the center if it's unchecked.
But you brought up something very interesting when it comes to glaucoma. It's not like, you know, my shoulder hurts and now my rotator cuff needs surgery. You don't really have a lot of symptoms that alert you to this problem early on, right? In
most situations, glaucoma is completely asymptomatic. The patient just doesn't know that they have it, and it can get very severe by the time it becomes obvious to the patient. So eye examinations without the presence of symptoms are very important for glaucoma.
Well, let's take a look at what's behind you because this is fascinating. This is giving you a great look at the eye.
This is a computer representation of the optic nerve, what we call an OCT. It's very similar to a CT scan, except that it uses light instead of x-rays, and so it's much safer and much quicker. It gives me an idea of the thickness of the optic nerve in different places. Over time that can change, and those changes can tell me whether the glaucoma is getting worse or whether it's stable.
All right. Very good information. Very important for us to remember. We need to come see you quite often. Once a year?
Typically by age 55 or 60, each patient should see the ophthalmologist at least every year or 2.
All right, we'll make a date for it. Thank you, Dr. William Haynes. And it's important for us to pay attention to a lot of the vision aspects when it comes to being able to see clearly. Coming up, we're going to be finding out about a growing problem for an aging section of our population. Live in Asheville, Victoria Dunkle, News 13.
Time right now, 6:18. The death of Amy. Well, you certainly do want your eyesight to be in great shape to see the leaves this fall.
That's right. News 13's Victoria Dunkle joins us live this morning from Asheville Eye Associates off Sweeten Creek Road. What conditions are people seeing at a growing rate, Victoria?
Well, it's a specific group of people who are seeing a certain condition. Baby boomers, as we know, are getting into those golden years more and more each day, and that is actually leading to an increase in the number of trips to the doctor for cataract treatment. Dr. Damian Macaluso is with Asheville Eye Associates, and he is the guy who helps people see clearly. You specialize in corneal health and cataract removal, and I understand you're seeing a lot more patients these days.
That's common. This is a very common problem that baby boomers have, and we know we're seeing more and more baby boomers now. So approximately 3 million cataract surgeries are performed each year here in the United States, and it's growing every year.
What's a cataract?
That's a great question. So a cataract is a natural clouding of the lens, and the lens does 1/3 of the focusing power. So this is a model of the eye, and the lens actually sits right here, right behind the iris. So when you look through the eye, you'll see the little pupil in the middle, and right behind that is where the lens is. And it should be clear like this right here. And what I tell my patients is that your lens is no longer clear. It kind of looks more like a chocolate M&M, and they seem to be able to understand that. And as a result, the image that gets focused on the back of the eye is no longer clear, and they can't see. So for most patients, they have an otherwise healthy eye. They can't see. It's no fault of their own, other than they're having birthdays. And we can help them out with this very great, very safe procedure now.
And let's talk about this, because this is a fast procedure. You said roughly how long?
Usually about 7 to 10 minutes for most routine cases.
And what are you pulling off in those 7 to 10 minutes?
So we actually remove the cataract. So the technology that we use is called phacoemulsification or ultrasound, and it's really been evolving over the last 25 years. It's computer driven, so just like computers in the 80s were kind of like took the size of a room, but now we have a smartphone. We've got a very strong computer in here that helps us remove the cataract with this very fine tip right here. And this is what removes the actual lens itself. It's a little hollow tip, and it vibrates about 15,000 times a second in a very small amount, and it aspirates that cataract out through the little hole right there. called phacoemulsification.
Once that's gone, you gotta put something back, don't you?
That's correct. So the lens does 1/3 of the focusing power for the eye. So we put in a lens implant, or an artificial lens. It's man-made, and these are made of various materials. Now they're not actually this size. This is to help you see here a little bit. But this is the optic that helps focus the light, and these little arms here are called the haptics. And there's different types of lens implants that we put in. I tell the patients the lens implant has really got a lifetime guarantee. It doesn't go bad, unlike some other replacement parts that people put in for patients. And there's even some advanced technologies for lens implants now, like this one called the Technis multifocal, that lets patients see far and clear and near without glasses, so they can actually get a more full range of vision and become less dependent on glasses. And this is actually a little model of the lens implant right here, actual lens implant itself.
Oh, it's so small.
It's about the size of a dime, a little bit smaller than that. And you can see the optic there and the haptics that we implant into the eye. And once it's in there, it stays in there forever and never goes bad and gives them very clear vision.
How quickly are they going to notice the change?
That's great. So the way we anesthetize the patient now is with some IV sedation and typically just numbing drops or a gel around the eye, so we don't have to do any injections. So usually the patient can start to see right after the surgery. We put a clear shield over their eye so they can see. And most patients start to recover some vision that night, but most patients get 90–95% improvement overnight with this.
All right, so we're hearing all of this. We know that cataracts are part of growing older. Who needs to be checking in with their doctor to make sure they're tracking this?
That's great. So most adults should have a dilated eye exam at the age of 40 and then check up periodically from then on until about the age 60. But really, 60% of people in their 60s and 70% of people in their 70s have the symptoms of cataract, which are simply the vision not being as clear or sharp, needing more light to read, having trouble driving at night. These are some of the early symptoms that become attributed to a cataract.
So you get your regular checkups, you work with your doctor, you spend a few minutes with you, and vision is looking good.
It's a wonderful thing to do because we can give people back the vision they've been missing and get them back to their lifestyle, their activities very quickly with minimal inconvenience.
Just another great reason to make sure that you take advantage of the opportunity to have regular eye exams. We've been showcasing the reasons that kids need them, the reasons that certain growing populations need them. It's just a good idea to get in touch with your eye doctor. I want to thank the folks at Asheville Eye Associates for letting us in early this morning. In Asheville, Victoria Dunkle, News 13.